It's the COVID safety scandal exposing health workers on the front line. Hundreds of paramedics forced to wear PPE that doesn't protect them. It comes as 3 paramedics have just tested positive.
After several hours, the teams emerged, head to toe in protective clothing. Then, for entry into Australia, were bussed to hospital after showing signs of the virus.
An alert for health workers who must now wear face masks.
Throughout the pandemic, PPE has been one of the main lines of defence for healthcare workers. A gown, goggles, gloves and of course a mask. A get-up that is far from comfortable, but one New South Wales paramedics thought was keeping them safe until now.
I think it's more of a stroke of just absolute dumb luck that there weren't more paramedics struck down by the virus and super unwell or even passing away from this disease.
Have you found that the vast majority of people yet been wearing the right mask and it's been working?
No, not at all.
A current affair can reveal at least 203 paramedics in New South Wales have been wearing masks that don't fit. New South Wales Health started mask fit testing in October last year for hospital workers and other staff. But for most paramedics, their gear wasn't tested until March this year, 12 months into the pandemic. Australian Paramedics Association delegate Brett Simpson is an intensive care paramedic working at Kogarah in Sydney South. Brett found out the masks he'd been wearing didn't fit and didn't protect him against COVID when his gear was tested just 3 months ago. He's now been assigned a specific mask for his face shape.
When you look back now, when we realise just how bad it was, and you consider that paramedics in New South Wales were the real front line of this pandemic. You know, we were the first ones on the Ruby Princess, on the cruise ships, at the airports, in people's houses, in people's offices, doing hospital transfers, and all the while we now find out that the equipment that we had, while sometimes was non-existent, when we did have it, was incorrect and didn't work at all.
What happens to paramedics who have failed a mask fit test and come into contact with a COVID positive patient?
Ultimately, if we do get exposed because we don't have the right equipment, we're going to find ourselves in 14 days of isolation, and a lot of us can't afford to be doing that.
At least 14 New South Wales paramedics have been ordered to isolate since March because of PPE breaches. Rebecca McCutcheon from Fit Test Australia has worked with 3 states' health departments to ensure frontline workers are wearing masks that work.
So when you're wearing your mask and whenever it's not fitting someone's face properly, air takes a path of least resistance, it's going to come in those gaps. So we found that a lot of the masks that are being issued to healthcare workers may not actually fit those individual workers, as a lot of masks come as a one-size-fits-all. And everyone's face is so unique that you do need to test the mask. You'll go to the other side for 2
Rebecca uses a machine that runs a 2.5-minute test to see if the mask in question provides an appropriate level of protection.
Fit testing is all about challenging that mask in motion. So once they've popped it on, we check whether or not that wearer is achieving a seal, then they will undergo some basic exercises to see how well that mask holds that seal when it's in motion. And it was kind of really hard to see these people struggle with the fact that they may have treated COVID positive patients or suspected, and know that the masks that they had been wearing were not providing them with the protection that they should have got from that mask.
She says men with facial hair often can't achieve a seal. But New South Wales Health says it isn't mandatory for their healthcare workers to be clean-shaven.
At the start of the pandemic, it was certainly mentioned to us that there could be a greater risk of if you have a beard, but at that time we were just getting around in our surgical masks and whatever P2 masks that were turning up on our ambulance stations.
In June 2020, the nation's infection control expert group said fit testing has not been widely applied in Australia. Despite increased awareness and demand in the context of COVID-19, fit testing of all healthcare professionals will be difficult due to limited supplies and range of types, sizes available. But 12 months on, that advice has now changed. Healthcare workers should complete fit testing before first use. In Victoria, their first and second wave saw 2,599 clinical healthcare workers catch COVID on the job. As a response, their health department started mask fit testing in October last year. Queensland Health says in its state, fit testing is not new and has always been a requirement for our clinical staff when treating people affected by airborne diseases. But says in March this year, it tightened and extended its fit testing requirements for all of its staff at designated hospitals treating COVID-19 patients. Queensland Nurses and Midwives Union Secretary Beth Mole says it was a top order priority for them.
There was wild inconsistency across hospital and health services, and we were very concerned about that. A detailed audit was conducted across the state, and now we have confidence that appropriate fit testing and fit checking is occurring.
New South Wales Health says supply isn't a problem and there are 8 different types of masks available, but the union is concerned that's not the case.
We're seeing staff leaving their fit testing and being given, say, a ration of 6 and saying, until you can get more, these are the ones that you use and these are the ones that we effectively have in supply to give you. So we have staff reporting to us as an association that they're actually rationing their masks and trying to pick and choose which patients are COVID positive or suspected COVID, just so they can make sure that they have their supply of the mask that they know is going to protect them and their patients.
Are you surprised that we've had a number of PPE breaches at this point?
No, not at all.
Why not?
I just think that there's a lot of masks hitting the market that are substandard.
We are under the pump, we are stressed, we are fatigued, much like everyone else, but we are feeling it a lot because we are really almost not the front line, we're almost behind enemy lines on this pandemic, treating people in the community and in the street.
You can read the full statement from New South Wales Health on our website.